Okay, hello everyone. Today we're going to be discussing diabetes, nutrition, and aging, understanding the link between nutrition, diabetes, and cognitive decline. I'm Kelly. This is Anna and Chris, and we are MSU Denver dietetic interns.
Hi, everyone. So today we'll briefly start by going over the various forms of diabetes, and then we'll go into the role of insulin, what insulin resistance is, and how insulin resistance plays a role in brain function, the current research and trending topics in cognitive impairment and insulin resistance. And then we will be going into different lifestyle changes and healthy habits for longevity and aging. And finally, we'll be answering all the audience's questions. But first, we would really appreciate it if the audience would fill out our pre-survey just to get a gauge to see where you're at right now.
All right, so while everyone is finishing up the survey, we have some objectives to state before the presentation. Much like Chris just mentioned, very similar in that we're sharing the impacts of diabetes across the US, distinguishing the different types of diabetes as well as insulin resistance and its role with cognitive impairments. And lastly, distinguishing the various dietary interventions to improve cognition for long-term brain health.
So I'm sure everyone has heard of diabetes, especially if you were here at the last presentation. But just to give you a quick overview, diabetes is a chronic condition characterized by elevated blood sugars, typically either with inadequate insulin production in the body or the body is become insulin resistant. Just to give you a few stats to kind of give you just the prevalence of diabetes within the US, about 38 million people have diabetes. That's 1 in every 10. 1 in 5 people actually don't know they have diabetes. When it comes to pre-diabetes, and that's with your A1C kind of within the range of you're not yet diabetic, but you're kind of in the category of pre-diabetic. About 98 million people, that's 1 in 3 are pre-diabetic. And more than 8 in 10 adults don't know that they have prediabetes.
All right, so what are the different types of diabetes? I actually had a patient ask me this a couple of days ago. So let's dive into that. So today we're mainly talking about type 2 diabetes as it relates to cognitive impairment. But to briefly go through the three, I know the previous presentation talked about the two as well, type 1 and type 2. But type 1 essentially is an accidental autoimmune response when the body attacks the pancreas, and the pancreas can no longer produce insulin. Now, type 2, on the other hand, is when the body can still produce insulin. It just no longer recognizes insulin as a hormone, which is insulin resistance, which I'll touch on in a few moments. And lastly, just to note, is gestational diabetes, which is when a woman who is pregnant has high blood sugar levels. And oftentimes, unless this is usually immediately resolved right after birth. So insulin resistance, this term is often thrown around a lot. And unless you have family members with insulin resistance, type 2 diabetes, or you work in that environment, it's almost not a super intuitive term that most people know about. So insulin in the body, to break this down, insulin is a hormone that is released from the pancreas to regulate blood sugar levels. So imagine you're eating a piece of toast. Toast is high in carbohydrates, and carbohydrates break down in the bloodstream into glucose. So when glucose is in the bloodstream, insulin is then triggered and released by the pancreas. And now imagine insulin as a key. The insulin will take glucose, it will unlock the front door of the cell and let glucose in. Now the cells, when they have glucose, then create or generate ATP, which is known as energy, which is then used within the cells to then perform their daily function, whether it's a brain cell, muscle cell, liver cell, the body needs glucose. Now, insulin resistance is that same exact process, except the cell no longer recognizes insulin. So essentially, the insulin is trying to unlock the key or trying to unlock the door of the cell, but the cell is not recognizing insulin, and therefore glucose is throughout the bloodstream. So there's increased blood sugar levels, increased insulin production, which then can cause type 2 diabetes or insulin resistance. So there are many complications of type 2 diabetes. These are just a few, but the one that we're mainly focusing on today is cognitive impairment as it relates to type 2 diabetes and insulin resistance. So once again, I mentioned that insulin allows glucose into the cell, and imagine the brain cells needing glucose to function. So without that process, that causes a lot of difficulties and impairments with cognition.
Okay, so what does diabetes have to do with brain health? So when we're starting to talk about cognitive decline and cognitive brain health, we started kind of what interested most in us in this topic was starting to see the term type 3 diabetes. And as Anna described, we didn't mention type 3 diabetes. We mentioned type 1, type 2, and gestational diabetes. But we wanted to bring up type 3 diabetes because a researcher, Suzanne De La Monte at Brown University, she really started to coin this term type 3 diabetes in the early 2000s. And really, she's looking at specific research related to, either prior to or coincidentally with memory changes of Alzheimer's disease, that the brain was losing its ability to metabolize sugar efficiently. And so we wanted to bring this up just as a quick, link that we found really interesting, kind of something that we probably will be seeing in the next decade of research of this term of type 3 diabetes. It's not something that you can be diagnosed with right now. And really, we wanted to point out that the research is showing correlations, but it's not showing causation. So by no means are we saying that type 3 diabetes or type 2 diabetes is causing Alzheimer's disease, but we are finding this interesting link between this correlation between insulin resistance and Alzheimer's disease. So just to give you kind of a brief overview of some of the neurodegenerative diseases that we'll kind of briefly talk about. Mild cognitive impairment, or MCI, is just characterized by subtle but measurable decline in cognitive ability. So it might be something that you might see within someone, but you're not necessarily going to recognize it as dementia or something like that. Dementia is then characterized by a significant decline. And that's really with the function, it's severe enough to really kind of impede their daily life. So it could be affecting their memory, language, problem-solving skills, attention, things like that. And then Alzheimer's disease, it's the most common type of dementia, and it's really progressive. That's the thing you should know about it, is it's something where the brain cells, the connections, the cells themselves really will degenerate and die. And eventually it really destroys the memory and really any other mental functions.
All right, so just to reiterate a little bit about what Anna had said earlier about this lock and key mechanism on this diagram right here. As you can see on the left side, you have insulin entering into the receptor. The insulin is the key, the receptor is the keyhole. As the insulin binds to the receptor, it allows for the front door to open and glucose to come in. Now, this is a little bit more of a complicated diagram, but just stick with me. The major thing on this diagram I want you to look at is this little blue blob in the top left that's labeled IR. That stands for insulin receptor. And the entire point of this diagram is that on the left side, this is normal brain function with functioning insulin receptors. And on the right, we have what researchers have found common to be patients with Alzheimer's. The insulin receptor is no longer on the membrane of the neuron. Yes, so this is a neuron, by the way. So the surface of the neuron, the insulin receptor will sit on it, but in a patient with Alzheimer's disease, the receptor doesn't sit on the receptor, which means that insulin is no longer able to bind to the receptor, which means that this whole process right here is unable to occur. So as glucose is unable to enter the cell, that causes a lot of issues. If you'd like to ask me any more about this diagram, I'd be happy to answer it, but it is a little more complicated than I like to go into. So what does this mean and why is it important? Well, as insulin resistance grows and glucose absorption decreases, in essence, glucose uptake decreases, which means synaptic activity decreases. And in layman's terms, that just means that brain function declines. So this is really important because the brain is the most heavy glucose utilizer in the body. And without glucose, it must compensate by changing to other fuel sources. Well, with these other fuel sources, that causes a slew of other problems that I will not be going into today. But that is the major hypothesis for why insulin resistance can cause or is linked to, not caused, but is linked to cognitive impairment and neurodegenerative diseases. But the really big important takeaway here is that insulin resistance exists on a gradient, and it starts with prediabetes. Prediabetes and type 2 diabetes are both preventable and reversible in most cases. And so that is a huge takeaway.
So how can we keep your brain healthy? That's kind of the next step here. So talking about specifically nutrition and diets for a healthy brain, a lot of the research is very much evidence-based, and they've talked about the Mediterranean diet and the MIND diet, which is a combination of the DASH and Mediterranean diet, but also lifestyle factors, which we've talked about in the last presentation, and we can get into in a little bit.
So the first diet that pops up in research, which I'm sure you're all familiar with, is the Mediterranean diet. And it was actually named this year in 2024 the #1 diet of 2024, which in comparison to other diets that have been out there, it's not the worst one that I've seen. But studies have shown that it not only improves cardiovascular health, but it improves blood sugar control in people with type 2 diabetes. So the main components of the Mediterranean diet are a lot of fruits, a lot of vegetables. Fruits and vegetables are both really rich in antioxidants, which are essential for brain health. A lot of whole grains, healthy fats, omega-3s, which are also healthy for brain health or great for brain health, as well as beans and legumes. Now, the one thing to note is with the Mediterranean diet is there's a really heavy emphasis on the lifestyle components, such as social connections. So as we know, there's not one cure-all that makes somebody healthy, right? There's a multifaceted system, and diet is just one of those. So within that realm, social connection is also one of those pieces. So social connections and dietary lifestyle or dietary interventions can really help and are big component with the Mediterranean diet.
Okay, and so the next diet that was mentioned in research is the MIND diet, and it actually stands for Mediterranean Dash Intervention for Neurodegenerative Delay. And it, as you can see kind of in this image, really breaks down looking at kind of the strategy really of looking at specific foods and categories of foods. And so it will put looking at whole grains, 3 servings of whole grains each day, berries at least twice a week, fish at least once a week, and so on. And really the research showed that diets high in saturated fat, sugar, refined carbohydrates really showed an association with worse cognitive function and increased dementia risk. But diets such as the MIND diet and the Mediterranean diet that were high intakes of vegetables and fruit, limited meat consumption, use of olive oil, they were associated with decreased dementia risk. So and it's less restrictive, I guess, is, instead of eating, A, B, C, and D, it kind of gives you these categories to kind of work in throughout the week. And if you want to hear more about the MIND diet, we have a great presentation after lunch with Colin and Nancy, so you can hear more about it then. But with lifestyle and exercise as well, as you'd probably hear, regular just physical exercise can really help reduce the risk of developing diabetes. And then it also can help with maintaining brain health. But then also just understanding any sort of predispositions within the family, empowering individuals to make kind of those proactive life choices. So if you know you have your family has a history of diabetes or dementia or anything like that, really being able to manage your diet and exercise to really mitigate that risk can help as well. And then, as Anna mentioned, creating a really supportive environment that promotes healthy eating and physical activity. A lot of the diets, Mediterranean and MIND diet, really emphasize physical activity. But if the social aspect of it too is that we all are going out and having dinner or hanging out with friends, if we're in a supportive environment as well, that can really help reduce the risk of developing diabetes and support brain health over time as well.
So in conclusion, millions of Americans live with type 2 diabetes and millions more live with undiagnosed type 2 diabetes and prediabetes. Correlations have shown that prolonged insulin resistance is accompanied by profound shifts in brain structure and pathology. But really what we want you to take away from this presentation is that diabetes is preventable with lifestyle changes like diet, exercise, and stress management. Aging may be inevitable, but healthy aging is a choice. So here are our sources. And if the audience wouldn't mind just taking this post survey really quick, we would appreciate it.
Did any of your studies talk about, I guess, how long people are able to follow the Mediterranean diet and the Mayan diet? Like, is there anything that talked about like the sustainability of people adopting those diets?
I think for the most part, both for the Mayan diet and Mediterranean, it seemed like it was of a lot of the diets that are out there, it seemed the most sustainable. It was something that at least within, I don't know specifically within the research that we were looking at, if it talked about like, years, a lot of the studies were pretty short. But it seemed like at least the reasoning behind trying those were that they were the most sustainable and also easier to like integrate within the lifestyle that they were trying to kind of keep. So.
Did any of the research you saw, I guess, say how long someone would have to have type 2 diabetes to see that correlation with the cognitive decline?
That was very much on an individualized basis. There was no strong indication of length of diagnosis. As I mentioned, insulin resistance exists on a gradient, and a lot of the time, by the time you have type 2 diabetes, that's clinically significant insulin resistance, but insulin resistance can exist long before that diagnosis.
Thank you.
I don't know if there's any like medications that target that, like how the brain is not utilizing sugar properly. Are there any medications that target that to try and counteract some of this? Or is that like the future? Are people looking into that or?
So in essence, any drug, any type 2 diabetic drug that would increase insulin sensitivity would, in theory, improve the glucose uptake and utilization, and then shift it back to glucose from other substrates. However, there's not much, I didn't see any personally, research on specific medications and insulin sensitivity in people who already have Alzheimer's disease. Although I do know that there are a number of medications that are believed to work that way, but I am not an expert in that field, unfortunately.
Is there?
Oh, I have a beginner question. How is insulin resistance measured? Is that the A1C?
Yeah, so insulin resistance, essentially if someone has a high blood sugar level, it's measured, which is also known as an A1C percentage. It's measured over the course of, I want to say 4 or 5 months. So typically someone's A1C, if it's elevated, indicates that they have either prediabetes or diabetes.
With this and cognitive impairment, and we're seeing, type 2 diabetes in the younger population, adolescents, are there any studies looking at maybe cognitive impairment in the younger generation, someone who's, uncontrolled diabetes, blood glucose? Have you seen any studies like relating to cognitive impairment? Like I know you talked about Alzheimer's disease and dementia, but are there any tests to look at like what's this doing to a younger population with diabetes?
I think most of the studies that we looked at were kind of that population that's already got dementia or Alzheimer's disease, and they were 65 plus for most of the populations that, at least in the studies I saw. But I think that would be a really interesting kind of future studies, as now that it's diabetes has started to become just more prevalent within the younger population. I don't know if you guys saw anything.
Yeah, I did not see any pediatric studies. However, that would be great for future research.
I realize this is not exactly the line that your topic was going down, but did you see any literature about diabetes in any forms and mental health? Because just thinking of the correlation between mental health or mental illness and cognitive decline, and thinking about the role in absence of other, neurological issues, if there's anything research that you saw with the connection between diabetes and mental health.
I personally didn't find anything around that realm, but that's fascinating to connect the two, especially as we're talking about cognitive impairment.
Yeah.
I'm sure, again, this is very new and emerging within the past 5-10 years. So I would hope in the next 10-15 years, there'd be something along the lines connecting that, especially because mental health is so prevalent right now. So that would be interesting to see, but definitely more research needs to be done.
I haven't read any studies on it, but I have heard allusions to it. That, again, along the same lines, when there's not enough energy available to brain cells, then, there are psychological effects to it. However, I have not seen any studies or read them myself.
With the Mind diet, how it said you should have fish once a week, or you get your proteins in. What would you suggest for people that were lower income, or I know one thing is farm raised fish is much cheaper than fresh, but can you still get the same nutrients if you had to get frozen fish from Costco, because that's just in your budget? Is that okay to do? Will it affect?
Well, yeah, I would say I get frozen fish from Costco. I feel like for the most part, I think it's similar to, I guess I'm not 100% sure, but I would say it's along the lines of similar to frozen vegetables and fruits, where the nutrients are trapped kind of as soon as they are flash frozen. That I think that's one of the things that was brought up in the Mind diet research that I'd seen, was that why it was so kind of encompassing for audiences is that it was not you have to eat this type of fish, you have to eat this type of berry or something like that. It's more categories. And so, yeah, it would be something where it allows for the socioeconomic side of things, that frozen is still kind of the same nutrients for the most part as, fresh. So yeah, you don't have to go out and catch a fish to be able to be on the Mind diet.
Any other questions? Okay.
Thank you.